Thank you so much for joining us and welcome to today's webinar. The topic for today is exercise as medicine for COVID-19, falls, and revenue. My name is Megan Klein and I will facilitate our meeting today. Please note the information contained in this presentation is intended to provide general information but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting qualified legal counsel. Today, our webinar will be presented by Colin Hoobler. Colin has a Doctor of Physical Therapy from Boston University, Master's in Physical Therapy from Drexel University, Master's in Exercise and Movement Science from the University of Oregon, and a Bachelor's in Kinesiology from Oregon State University. Colin is passionate about helping vulnerable populations such as older adults, children, and those suffering from chronic pain. To this end, he created and hosts the podcast Action 30, a public service for those who need exercise and lifestyle guidance but cannot afford it. He has also founded and developed many outpatient PT and training clinics and is a health writer for the Oregonian. He created The Fitness Show, a PBS TV series showing how exercise can help overcome injury and disease. Colin was also a health expert for local NBC News, hosted his radio show Smart Fitness, and has written 2 books. And now, please welcome Colin.
Thank you very much, and welcome everybody. This is a course that is very appropriate, but also it's extremely relevant to the times. And I'm going to really focus a little bit more on COVID and falls. Those 2 things are really going to obviously be the focus. But the first part of this is really going to be more about a general. It's going to go from general, and then we're going to go more and more focused down to COVID, because in order to appreciate what the recommendations I'm going to provide, it does require a certain, shall we say, attitude about how to approach this, because the information that I'm going to share, it actually applies to you as well, to you, to staff, and obviously to older adults. Older adults are more vulnerable, so the margin for error is very small for them. Lastly, before we go to the next slide, the last thing I'll say is this information is fluid. What I'm going to talk to you about for COVID is changing. So everything that I'm going to give to you is based on current best evidence that I've been able to find through my research and through working with peers and universities that I work with, but also that this could change literally, in 2 to 3 months or sooner. And so I'd like to invite you to future webinars where we need to stay on top of this as that recommendations change, just like the recommendations with masks change. And this really sums it up. You really have a choice, both yourself and your residents. What really fits your schedule? I mean, if you don't exercise and you don't do it daily, just like if you don't brush your teeth every day, there's going to be a really big price to pay. Okay, so let's go to the next one. And I think Einstein proved this, 100 years ago. This is a humorous look at it, but yeah, the time is actually money. So I got to ask, let's start off with a little thing that kind of sums up today. This is kind of the target for all of this. Which carries the most detrimental or most negative health effects? Is it A, smoking 10 cigarettes a day, B, eating fast food every week, C, sitting 10 or more hours a day, or D, avoiding sex for 10 years? Yikes. So what would you say? I mean, these are all pretty lousy things for the body and for the mind, right? But the answer is C. It does carry, out of these in particular, it is the most detrimental. And Dr. Levine at the Mayo Clinic has coined this sitting disease. This is where they kind of oriented out of the Mayo Clinic about how devastating sitting is, especially for older adults. It is catastrophic, to say the least. Next slide, please. And when you look at this, look at all of these issues. These are strictly from sitting. Notice chronic pain, osteoporosis, anxiety, depression. These are things that, and immune compromise. These are the biggest things that we tend to deal with in senior living. And it's time to start looking at, and diabetes, of course, at why we're having such displacement, disability, and early death. Why is this happening? And it's largely because of sitting. When you sit too much, it is catastrophic. But I think what I hope through today is you're going to appreciate more specifically why is it so catastrophic, and then what can we do about it. Okay? Remember, this applies to us as well. Exercise, purposeful exercise. Now, we're going to get into exercise specifically. What does it take to fight all of these things? Because it's not practical to have a program that reduces chronic pain, and then another program that addresses anxiety, and another that addresses depression, and another to boost immunity to fight COVID. That is completely impractical. So the other benefit of today is, what I hope you'll appreciate is, we're going to do a major overlap of how to prescribe, how to program that's going to give you a huge bang for your buck that's going to address all of these things. Okay? All of them. And we're talking independence, longevity. I mean, that's what this is all about. Okay? So purposeful, effective exercise, there are basically 4 components, right? There are 4, and these are the 4 fitness components. Number 1 is strengthening. Now, if I ask you, what is the definition of strength? What is a strengthening activity? What would your answer be? I want you to think about, well, what is strengthening? Because if you don't know that, that is the same as a doctor really not knowing, if you're prescribing, if you're doing programming, as a doctor not understanding what this particular medication will do for diabetes or heart disease, that kind of thing. So exercise is medicine. So remember, we're going to address what the definition is of strength, and we'll do that later. The next is flexibility. So improving range of motion. That's pretty self-explanatory, but there's some parameters for that I'm going to introduce that tends to shock people as well. Number 3 is endurance, and that's being able to sustain the activity for a certain amount of time. And then the 4th is body composition. So we're going to address each of these. Now remember, today, just like Megan said, this is a general, in a sense, a general approach as opposed to an in-depth for each one. We are going to go more in-depth for COVID and falls, but each one of these warrants, a pretty long discussion just to make sure that you don't hurt people and you get the most out of what you want to do. So I have to ask, which of the following are actual strengthening activities? We have A, walking 20 minutes. B, swimming 15 minutes. C, where you're running up a hill for 30 seconds. And D, for all of these. What would you say? What do you think? Well, walking, so A is an endurance activity, right? And you know that because of the time. And we're going to look at this more specifically in a second. But swimming, you can know that for the time. That's endurance. That's not strengthening. But when you're running up a hill and it's only for 30 seconds, well, that means you're tired and you stop. That is a strengthening activity. So the answer to that is C. Next slide, please. And on more of a general approach, I think that, especially, and you're going to see this with the next slide, and this is more for you. I answer this question a lot. So if I want to maximize fat burning, if I want to really burn fat, and this applies to older adults too, because excessive body fat is inflammatory, which can actually increase the risk of COVID and dying from COVID. So this does apply to older adults, but it also applies to us. So we should do endurance activities before, or do you think we should do it before or after resistance training? So is this true or false? So we should do it before resistance training. Is that true or is that false? The answer there is false. And I want you to appreciate why that's the answer, because that will have implications for COVID. We do want to make sure that we're that we're not allowing residents to get too heavy. Obviously, that's a challenge nowadays with having to isolate and that sort of thing. But this adds another layer of appreciation for having excessive body fat on us as well as residents. Next slide, please. So this is a very busy slide, and I'm going to be saying next a lot. But I hope that this will help you understand the previous questions, but also implications for programming for COVID and how these different types of exercise, what their effect is on different disease states. So first one there, when you're exercising, the first 30 seconds, just like I said with running, if you're doing something high intensity, the energy system that you're using is ATP, CP, adenosine triphosphate with creatine phosphate, right? Keep advancing the slide here, okay? Is ATP and CP. It's in the muscle, it exhausts quickly. When you get past that, up to about 180 seconds or 3 minutes, you use, and we all know this, is the lactic acid. It's the burning that you get with intense exercise, right? That's the hydrogen ions being liberated by muscle, and that's what caused you to have to stop. You physically can't contract. This is the strength training. Keep progressing here. This is the strength training mode, right? This is where the strengthening and doing exercise that causes you fatigue quickly, Alzheimer's, immune function, okay, hormone release, depression, and osteoarthritis. These things, that's where strengthening is extremely valuable. And it's not that cardio, doing endurance activity, is not beneficial for those things, but when it comes to strengthening, if you have chronic pain, especially with osteoarthritis, this is a way to reduce joint forces, but it has to be done properly. We're going to look at that as well with the squat exercise. That's going to be later on. Now, if you keep going, if you're able to keep going, greater than 3 minutes, that's when you're doing cardio. That's endurance. Okay, we call that aerobic. Now, where does that term aerobic come from? We'll look at that here in a second. But the thing is, only 3% of what you're doing is aerobic. Aerobic means with oxygen, right? So the more you keep going, you're dumping more and more oxygen into the flame. So at 10 minutes, you're about 50% aerobic. At 20 minutes, you're at 97%. And then theoretically, starting around 30 minutes, you're 100% aerobic, which means you're basically burning all fat for fuel, and which is actually technically impossible. You have to have carbs to burn fat. Okay, that's a whole other discussion there. But the molecule you see there, look at the C16H32O4. That is a fat molecule. And as you can see, there's a lot of carbon, a lot of hydrogen, not much oxygen, and then you've got to dump in a lot of oxygen to make that metabolize. And that's where fat goes. It turns into carbon dioxide and water. And so you breathe it off, and you sweat, and you pee out the rest. Okay? And this is important because when you're talking about COVID, you were talking about how can I reduce any inflammatory process at all. I need to bring that down. And exercise, if you do it properly, will burn fat if you do, the longer you go. You can't use fat for high-intensity exercise, right? But when you're talking about endurance activity, that is a big deal for lowering body fat. Now, go ahead and progress the slide. You can make this move all the way to the right. You can start moving it right, meaning it's harder for you to use fat for fuel if you're stressed out. Is anybody stressed out right now? Yeah, so the more stress you have from being isolated, from having to deal with COVID, from losing your job, from just all the stress we're enduring right now, it makes it harder for us to use fat for fuel. You become less efficient. You can also move everything to the right, make it more inefficient if you have medication. Go ahead and progress. Or diet. So diet and medication. Those are other things that can move all of this to the right. Good nutrition is critical, obviously, for recovery and that sort of thing. But I'd like everybody to remember that when it comes to programming, each of these carries a specific benefit with some overlap. So when we talk about specific for COVID, programming for COVID, please remember that your classes, they need to incorporate what strengthening is, which means people are getting tired quickly, and then they feel like they need to rest, coupled with going on longer walks, which is specific to the person, right? And it all really hinges on this, folks. it's how hard the person is working. So how hard does this person feel like they're working? How many of you actually ask your resident, I need a number between 0 and 10. You go ahead and progress the slide here. You can, between a number between 0 and 10, how hard are you working? And you get that number. If you're going to prescribe exercise for anyone, especially an older adult, you are basically flying blind if you don't get this number every time the person exercises. So there are 3 scales. This is board scale. It's 0 to 10, where 0 is nothing, 10 is max. There are 2 other scales. One we use in cardiac rehab, which is 6 to 20, which tends to confuse people. There's another one, 0 to 11, but they're all evidence-based. For simplicity, I tend to stick to this guy, which residents and patients tend to understand. And again, look at the middle number. So if somebody says, yeah, I'm pushing this, this is hard. Strong means hard. That means that they're at a 5. If you ask them, how hard are you working? And they say, this is really hard. This is really starting to push my limits. That means they're in the 7 to 8 range. If you ask them and they're like, oh yeah, no, this isn't bad at all, you're in the 2-ish range, maybe 3. But really, it is really important that everybody understands that scale. But this scale dictates how hard they're working, dictates if they're going to get hurt or not, how much they're going to improve, especially with COVID. And you're going to see that there's a specific range that people should work in to protect them from overdoing it and then just basically wasting their time. So it also dictates how long and when you're going to progress them. So if you're talking pain reduction as an example, right? Pain reduction, you can push the limits on this, 4 to 10. So you can take somebody and you can really push them. Now, obviously, if they're new to exercise, you don't want to, okay, Margot, we're going to really push it, and you're trying to get her up to a 8 or a 9 or a 10. No, of course not. But eventually, as Margot, as she exercises more, you can then start to push her more and more and more. And all that's going to do is reduce her chronic pain, especially for back pain, knee pain, those types of things, the chronic problems. For cognition, to improve cognition and using exercise, we know that the scale is lower. So and that's displaced there a little bit. It's actually from, about 2 or 3 up to 8. You don't have to push as hard for a cognitive benefit. But for those of you that are implementing cognitive-based programming, where you're trying to improve cognition, especially for memory care, that's great. However, you do not get the benefits that we've shown using exercise to improve white matter in the brain. So when I say cognitive effects, I'm talking about full scale from the brain all the way to the muscles, through the lungs and the heart, etc. That's why exercise is so potent. It gets so many different areas of the body as opposed to just one, just doing the brain or just doing social interaction. Those are great things, right? Obviously. But without exercise, carefully prescribed exercise, you miss out on all of those other benefits. And they're key. They're instrumental just to be able to stay independent. So this is a perfect example. This woman, and I've seen this a lot in PT clinics. I've seen it in senior living communities where you have somebody doing, this is just a basic squat. And this is my idea of what not to do. Because when you talk about what proper intensity, if you were going to ask this woman, how hard do you feel like you're working? She would say, maybe 2, maybe 3. So she's not pushing it at all, right? But she only does this exercise, right, for about a minute to a minute and a half. So you tell me, where does she end up? What's the benefit of doing this? It's not a strengthening activity because she's not pushing it. She doesn't have, an RPE of at least 5 or 6 or 7. That's what you need for strengthening. So she's forfeiting all the benefits that she's going to get for the strengthening piece, right? So, and it's not endurance because she's stopping after, a minute or 2. So this leaves you in no man's land. So when you program, please, you've got to decide, what is it that I'm trying to do here? Is it a strengthening activity? Is it endurance activity? You can't do both at the same time. They're very distinctive. They're separate. Okay, so I really want to stress that if you're looking to use exercise as medicine, we've got to separate the two and program accordingly. Otherwise, you're not going to see a reduction in falls. You're not going to see an improvement in reducing COVID contraction and mitigating the effects of COVID. Okay, it's extremely important that we understand this premise. So when you talk about immunity, what are the exercise parameters to boost immunity? What are they? What do we need to have here? Can it be sitting or standing? Moderate intensity? At least an hour a week? Or all of them? What do you think? The answer is B. And the reason it's B is because A is not correct because it's sitting or standing. All the data, and we're going to talk about this, all the data that I've seen, there are over 5,000 papers on how exercise affects the immune system. It's got to be standing. Sitting just doesn't do it, and it does nothing for falls. So when you're talking about fall reduction and immunity, you got to be standing. So A is out. C, at least 60 minutes a week. The research says it's got to be more than that, at least twice that, actually, for immunity. And moderate intensity, that's where you want to be. So how hard are you working? They're going to tell you 3, 4. You know, this is moderately hard. That's what you want to hear for immunity. We'll talk more about that in a second. So the immune system. So this is really key, people. So now we're getting into the nitty-gritty. So immune system function. So if you want to improve the functionality of the immune system to fight COVID and make it so that you don't contract it, as well as if you do get COVID, that you mitigate its effects, you want to be in a range here. We'll share the range. It's got to be in standing. You got to have moderate intensity and about 2 hours a week, roughly. Now, the one thing I will say, you know how they measure this? This is one thing that I, as a little sidebar here. Cytokines, if you haven't heard what cytokines are, they're small cells, they're proteins, and they work as communicators with other cells. And what happens is people that have COVID-19, they have a lot of these cells, a lot of cytokines, right? That increases platelets. It makes platelets, it increases inflammation, so platelets are signaled, so there's a lot more platelets in the bloodstream. And so what you can probably bet is it increases the risk of coagulation. And that means a coagulopathy is what we call that in medicine. And if you get a person who is sedentary, who doesn't do anything, they just sit, that's a perfect storm because you have COVID plus this coagulopathy where they have a lot of coagulation and inactivity. And each fuels the other. Each one now is making it so that you have a perfect storm. And research shows that you can increase the risk of death for that situation for people that are inactive, right, with this increased cytokine by 800 to 1,000%. So if you wonder where a lot of the mortality is coming from, it's this prolonged sitting with COVID, and that seems to be a major player with this cytokine production. Okay, so what we're looking for here is a moderate to strong intensity. If you're wondering, how do I improve the immune system? I got to have them standing, and they got to be working anywhere from a 3 maybe to a 5, and that's your sweet spot right there. So how hard are you working, Bill? Yeah, this is moderately hard, and he's in standing, and he's doing that for up to a couple hours a week. You've nailed it. You have a tool now that's boosting Bill's immune system function. Now, if you go higher or lower than that, this is tricky. If you go too high, if you go too low, the data is pretty clear on this. If you push somebody too hard, like Bill, and Bill's really anxious to get going because he's been all cooped up, and then Bill, oh yeah, Bill, we're doing these standing exercises, and you ask Bill how hard he's working, and Bill hasn't been doing much lately, and you start working into the 7s and 8s, that can actually have the reverse effect where you impair Bill's immunity. You actually make it worse and make it more susceptible to infection, including COVID. Same token, if they're not doing anything, we do know now, it's safe to say, that kills the immune system. It dramatically reduces it. Now, where a lot of this data comes from is HIV. That's actually where a lot of this started. Where a lot of this data started because using exercise with HIV was truly remarkable. That was a tool that wasn't discovered until a few years after it had been gone mainstream. And we found that using exercise along these lines, it improves immune system function, independence, quality of life, brain function, and it reduced depression in these folks. So using exercise properly can do remarkable things for state of mind and state of body. Now notice there I said wobble. You see that where it says moderate to strong and it enhances immune system function? I want to wobble. A wobble means when you're standing that you're inherently unstable. Okay? I'm going to show you an actual real life example of that. And the woman there on your left, she's wobbling. Okay? And you don't have to have S3 balance to do this. You can do it manually. But S3 obviously makes it so you can scale it and do classes and really get a lot of people involved. That was the whole purpose. That's why I invented it. But notice her hand position. Diane is very unstable doing this. Okay, so what she's doing is she's just touching the handlebars, and that instability is what creates stability. And so she's not just reducing falls. See, she's having a good time there. She's learning how unstable she is. She actually has a vestibular impairment. The woman on the right, see, she just almost fell. And the reason she almost fell, if you do this manually, right, if you don't have parallel bars or S3 or anything like that, that situation there is very dangerous, because when you are losing your balance, when you start to lose it, as she just did, if you don't have grounding, it's called neural grounding, if you don't have a reference to the ground, like S3 or something that's stable, or even the wall, where you're on either side of a wall, like standing in a corner, it creates confusion and you fall. So if you do this manually, I can't stress it enough, make sure you have really stiff arms, stiff shoulders, so that the feedback is consistent. That's especially true for people who are extremely low level, right? The lower level they are, the higher risk it goes. If you have somebody who's really high functioning, it can actually be beneficial, because then the somatosensory system has to work harder along with vestibular. But again, coming out of COVID, the majority of these residents, especially memory care and assisted living, are really going to be in a bad spot. So be prepared to get them standing. They got to get up, get their immune system going again. If you don't have the proper equipment and you're doing it manually, please make sure that there's stiffness in the arms and shoulders. Don't let them just give way like what just happened there. That was his holiday retirement. And this is this lovely woman does have a vestibular impairment, and this is, if you ask her how hard she's working, that's an 8 or a 9, and she's flustered, right? She's pushing herself too much. She had too big of a step there, so she was really unstable, and that's what you don't want to do. You want to set people up for success. I wanted to show an example there of an excessive wobble. A wobble means you're just barely unstable, right? Now, before we address this, we got a question from Allison here. Thank you, Allison. Are there any benefits to continued therapy exercise while a person has tested positive for COVID and is symptomatic, specifically in long-term care? There's not a definitive answer for that I know of yet. What I do know is that the papers that have been published for people that do have COVID, there's this wide range of symptoms, is that exercise becomes contraindicated if they struggle to walk, if they struggle when they do get up, they have hypotension, you take their blood pressure and it drops. When they stand up, they get dizzy. It's contraindicated if their O2 sats drop below 90. So if you're getting, in that type of situation, then exercise is contraindicated. But other than that, we do know that exercise, lower level exercise, so starting it slowly, again, using RPE. So if somebody is symptomatic, use RPE. That's your best tool, and ask them, how hard do you feel like they're working? Because most likely you're going to see an increase in respiration rate, you're going to see an increase in blood pressure, and they're probably going to tire out quickly, but you just got to watch for hypotension. They can pass out. But we do know that exercise is beneficial in that situation. But what I would work in every single individual situation, check with their doctor, make sure that they are cleared for it. And if they are clear, make sure, if you have access to it, know what their O2 stats are, take their blood pressure before getting them up. And then when you do get them up, stay with them and check their RPE at least every 5 to 10 seconds to make sure that they're not getting up into, above a 5. You start getting up there, and now you're actually going the other way and possibly making your immune system worse. So I hope that answers your question. Thank you for that. What are the exercise parameters to reduce falls? So that's basically kind of in a nutshell for COVID as it is right now. When it comes to falls, that's what we're going to go into now. But again, I'm going to show you how the overlap does happen for falls and COVID, so you can get both. So what are the exercise parameters to reduce falls? A, sitting or standing. I already kind of gave the answer to that one. B, moderate intensity, at least 45 minutes a week. Or D, all of them. Well, it's D. So it's got to be in standing. We do know that if you want to reduce falls, doing sitter-size or, this stuff in sitting, it's great to improve, upper extremity range of motion, possibly upper extremity strength if you are pushing that with dumbbells. But it really just doesn't have any influence on falls. There's just no data to support that. And in fact, doing seated exercise with the assumption that it is going to reduce falls is counterproductive, and that's not a message we want to send in senior living. We really need to make it clear that if you want to reduce falls or improve stability, you have to introduce instability in standing. That's how you're going to get vestibular, somatosensory, musculoskeletal, and visual systems working together to keep balance regardless of where they're starting from. Okay, and that's where using RPE is key. Okay, so moderate intensity, next slide please. So when we're talking about fall risk, we measure that with the functional reach test, the Berg, the timed up and go, the Tinetti. You may have a favorite. I personally prefer the functional reach test because it's so easy and quick to administer, and it costs nothing. So before you go spending thousands and thousands of dollars on fall assessment tools, please, I really implore you to try one of these lower cost tools that have been shown by the research to be reliable, valid, and have high inter-rater reliability. Okay, that way you can measure what their fall risk is at the start, and then as an outcome measure to see how they're doing. But when it comes to fall risk, these are the parameters. A lot like COVID, a lot like for the immune system, right? Got to be in standing. Their intensity is different here. You can get away with more. And we're talking about 150 minutes a week, but that is dependent on 150 minutes a week. That can shrink dramatically if you increase the intensity of the balance training. We know this. So if 150 minutes a week means that you're just kind of sticking around in that, moderately to strong range. If you start pushing, that number will go down dramatically. Okay? Next. And we're looking for a moderate, and then you can go all the way up on this guy. You can really push, but again, it depends on the person. Obviously, if they've never done balance training, if you look at them and you're like, geez, they have trouble standing, just standing up, please make sure that you use RPE. Say, how hard are you working? How hard are you working? And if they're just starting out, have them in the moderate to maybe difficult range, but certainly no more than that. You can turn them off in a hurry by pushing them too much, right? But you still, and especially with balance, you've got to have a wobble. You really need to have it where they are unstable. If you're using a chair, I see a lot of communities use a chair where they're touching the chair. Not safe to have the wobble there, is it? Because if you wobble and you need the chair, that you can get sued for that. That's a high liability issue. You want to make sure that you have something that is stable to the ground. Okay, it's got to be stable. Don't use a chair for that. And if you do seated, or if you just don't push them, so without a wobble, that kind of thing, it's great to disrupt their daily routine for being sedentary, but at the same time, you're not going to get that effect. You've got to push them to higher and higher levels. And if you want both, so if you're looking for immune system function and fall risk, this is the take-home message here, this is your range. Go ahead and advance once. 3 to 5. So coming out of COVID, everybody's going to be, basically everybody's going to have deconditioning issues, right? We're going to see an increase in falls. That's a no-brainer. We're going to see progressions in diabetes, heart disease, depression, all these issues. So please make sure that you start people off relatively slowly. I think that's a no-brainer. But use this scale. How hard are you working? Bill, Mary, Marge, okay, we want you to be right around the 3 or 4, and tell them that before they start exercising. Don't start and then say, oh, by the way, we have this scale. Make sure you tell them ahead of time, we don't want you, to exceed a 3 or a 4. It's extremely important that we work into this slowly. When it comes to resistance training and strengthening, I know it makes a lot of people grumpy. That's my dog when she sniffs, the nail polish remover. Why? Thought it was funny, so I thought I'd show that to you. But when it comes to resistance training to build strength, the first thing, there's some parameters here. So when you're doing this for COVID, falls, whatever have you, we want to minimize time. Number one, we've got time, just like I had with that Gary Larson cartoon at the beginning, time is everything. People, they always say, well, I don't want to exercise because, it takes too much time. I have other things to do. So we need to be really creative in how we prescribe the strengthening, everything that we do to minimize time. Number two is we need to minimize joint stress. That is a big one. That's huge because in any walk of life, I don't know if you've ever, when you work with somebody in senior living and they hurt their knee, you have them do, let's say, a squat or a stretch or something, and they get that zing, in their knee or their shoulder or their back, they're done. You've lost them. And the trust goes way down and that sort of thing. So this deserves a whole other course on how to strengthen to protect joints. I'm going to give you an example coming up here shortly on how important it is to minimize stress and how to do that. You also want to maximize muscle work. And maximizing muscle work is key because then if you do that while protecting your joints, guess what happens to the time? It goes way down, way down. So if you know your stuff, if you know your biomechanics and you're creative and you know how to protect joints and overload muscles in a hurry, you become highly desirable in this industry because now you've eliminated time as an excuse. It doesn't take much time at all to get the benefits to fight COVID and to fight falls, okay? And that's why. I mean, obviously COVID, blah, blah, but boosting human growth hormone with IGF-1, those are basically that's the holy grail for Fountain of Youth. We know that human growth hormone with IGF-1, that's what precipitates maximum recovery, and which leads to longevity and quality of life. So when you do strengthening, it's really the hormonal response that is absolutely priceless because it also boosts white matter in the brain. You think that exercise is powerful medicine for falls and COVID. If you do it properly and you get the intensity up high enough, white matter in the brain, prevention of Parkinson's, Alzheimer's, as well as mitigating their effects if you do have them, is astounding. The data's there, and it deserves to be respected. And we talked about, obviously, falls and chronic pain. Next. Okay, so the technical look, so if you do strengthening, and this is also a look at the wobble, okay? So for balance training, so you can fight COVID, fight falls, this is a mechanical look. So if you've taken biomechanics, I think this will be kind of a fun slide. If you haven't, I think that this will help you to understand and appreciate what goes into effective programming. So the first thing you got to understand is what torque is. Everybody, I want you to put your arms straight out to the side, just like Tawny's doing there with her dumbbell, okay? So the axis is your shoulder. The lever arm, and you can keep progressing there, the lever arm is your arm. And the force is your arm. And it's greater with her because she has a dumbbell in her hand, right? But that is relative to gravity. So the torque is all about the shoulder, right? And it's a rotational force. And we call that a moment. So when you're holding your arm out just like this, you're maximizing torque if your arm is all the way straight. To make that easier, just bend your elbow. And that cuts the torque in half. So if you to maximize torque, that means that you maximize work of the muscle, which means you maximize caloric expenditure. You can burn more calories by doing strengthening this way. It's called mechanical disadvantage for those of you that have studied this. Let's look at the strengthening aspect, which here you can see Tawny, she's holding a dumbbell in her hand, okay? So the lever arm, the axis is her low back, right? When she squats down, look at the red line. Look at what happened to the lever arm. The lever arm doubled, okay? It doubled. That's what we call a huge, that is a large lumbar flexion moment. Okay, that means that her low back muscles are having to work overtime. And the depth, look at how deep she's squatting. That's about a 110-degree angle at her knees. So we know that the low back and the knees are taking a huge hit here, a big hit. So how do we fix that on a squat? What do? We fix it by doing that. So what we do is we take Tawny, we make her more upright. Now look at what happened to the red line. And some people say, well, I reduced my range of motion, so my quads are doing less work. My hips are doing less work. Not really. The research shows that when you do this, if you do a squat this way, you do lose a little bit of work in the glutes and the quads. But what happens is you're trading a little bit more work of the quads and the hips for massive loads in the knees and the low back. And this is a lot harder to do, frankly. When you maintain, see her low back, this is beautiful. Look at her nose relative to her knees. Her nose is not going past her knees. Her knees are over her toes, which is what you want. You don't want them going past the toes, so her hips are back, and she's not arching her back. That is a huge, huge deal when it comes to strengthening that you've got to pay attention to. You can't just tell people to squat down and think that it's okay. That you think this is what you're aiming for, because this helps protect their joints. Again, exercise as medicine. And this is the knee. So when we're talking about knee forces, and you guys, you can look at this, look at the data yourselves, okay? When you squat, when you do a deep squat, and when you flex your knee, you can do that right now. So when you bend your knee under your chair, wherever you're doing, the patella goes inferiorly. It moves downward, right? So the forces, we know what the data says when it comes to forces at the knee. When you do squats, when you do closed chain, when you do leg press, when you do lunge, when you do squat, that the forces on the knee, to compromise those in a hurry, is when you break that 50-degree mark of knee bend. You want 50, maybe 60 degrees. There's one paper that says 60, but you want a lot of contact area between the patella and the femur. So that right there, that's the patella moving on the femur, which is your upper thigh bone. And you want a lot of contact area, because if you don't have that, pressure equals force over area. So having a small surface, having a small surface area will increase the pressure with the same amount of force. Next. So the approach for doing strengthening, doing resistance training, if you will, is and again, when you're doing your programming for this, do your major muscle groups first. It saves time. It saves a heap of time. So if you're programming for COVID or falls, so by the way, with falls, if there's one muscle group for falls that you want to focus on, it's the quads and the hips. Those two, but especially the quads. We know by strengthening just the quadriceps, just them in a standing position, can reduce falls by 80 to 90%. Just that one muscle group, right? So when you're doing strengthening, I always suggest to people, do major muscle groups first. The major muscle groups, chest, quads, and back. Those three. If you do those first and you make it part of your programming, guess what? If you do those first, you get the minor muscle groups too. So if you do a squat, you also get low back, you get glutes, you get hamstrings, calves, and trunk. 6 muscle groups right there. Okay, go ahead and go next. If you're doing, for example, Cedar Row, you may not have this equipment at your facility, but you can use bands. But what I want to show you is look at the position of the head when you're doing back. So when you're doing back, your chin is up and your chest is up. You're not just pulling toward your body. You're pulling, thinking about using your elbows. Notice I say take 5 seconds to set up. Those of you that play golf, do you just walk up to the ball and just whack it? Well, I do sometimes, but no. I mean, if you're trying to do it right, the answer is obviously no. So with resistance training, which is a lot more, carries a lot more consequence than just hitting a stupid golf ball, this you got to take at least 5 to 10 seconds to get set up. And then this third step is when you start, is that you are focusing on that muscle group. So rather than just falling into a squat, or doing chest or back, whatever it is, you are telling the person, don't just fall into a squat, don't just pull the band towards your tummy. You are trying to use those muscle groups. Okay, let's not waste your time. Tawny's a stud. She's doing a push-up there. That's perfect push-up form where the hips are elevated a little bit. That helps protect the spine, but it also overloads the chest more. But what she did was she set up. She took 5 seconds to get the setup right. She focused on using the pecs, and then she carried the same speed up and down. With the caveat here for your seniors need to develop more power, which is work over time. So I would suggest starting with moving the same speed up and down. Whatever the programming is that you're doing, same speed for safety. And then as they get better, you can start to develop more power. So when the concentric phase, or when they're pulling toward them or pushing up, you should have them do that quicker with a little bit slower on the down phase. So you vary the intensity, you start to vary the rep range, but also the speed, especially the concentric contraction, where they're not just haphazardly pushing up or just falling down into a rep. So I hope that makes sense. I've got another question from Alexis. Thank you very much. Increased perceived intensity over 5 results in decreased immunity, but for how long? What a great question. The answer is I have no idea. The research really doesn't specify because of, obviously, I don't even know that I've seen that the studies have shown for how long, but in the papers that I've written, that it does reduce, but it is relatively short term. So let's say they have a single bout of exercise for Mary and she overdoes it. And, Mary's in her 80s. Well, it's been shown that she can return to exercise and basically reset within a week. But again, it depends on other factors. So if Mary is exercising and she overdoes it, well, she can actually cut down that recovery time by having good sleep, having good diet, and those kinds of things. So many other factors at play. It's definitely not a long-term decrease. So it's not like you're done. It's not like you're in for it for the long term. That I know, but whether it's a week or a couple of days or what, I haven't seen specifically what that means. And then you ask, would a resident be more likely to get sick after an intense workout? The answer there is yes. That has been shown. That was shown in elite athletes first, and now we're starting to see it in older populations in middle age, where it does predispose you to disease, to getting an infection, because it does reduce the immune system. It does reduce the immune system function. They do see an increase in the cytokine production, which, then you start getting that coagulation problem, that sort of thing. So what I would say is it's not all done if you make an error, they go too intense. It's definitely not, it's not catastrophic, but it could be if you don't fix it quickly. I hope that answers your question. Thank you. Next. Flexibility is weird. And the reason why I say it's weird is because of the concept test that I'm going to ask you. The flexibility, as everybody has stretched at one time in their life. Some of you stretch more than others. Some residents, they love it. Some hate it. But the idea with flexibility is to reduce joint stress. So you're using yoga, you're using some methods with Tai Chi and just basic stretching. We minimize joint stress and it can reduce pain. And the mechanisms are not exactly known, but from a mechanical standpoint, if you have a joint that moves from only 0 to 90, that means that the force is distributed over, let's say, 90 degrees. If you increase that to 100 degrees or 110 degrees, now you're distributing forces over a greater surface area. Pressure equals force over area again, right? So when you increase the surface area, you decrease the pressure. So the idea with flexibility is to protect your joints, enhance joint health. One thing here to be careful of, you don't just go into your stretches, right? And I was very careful with the programming with S3 to make sure we adhere to these principles. Look at how she's stretching the lats and the shoulder. She's not just grabbing and then flexing her trunk and going down. Her palms are up. Why is that? Why do we care if her palms are up? And she could actually grab that pole instead. But the reason it's called impingement, when the palms are down, it takes the largest part of the bone, of your humerus bone up here, your upper arm bone, and it presses it up against the acromion. It's called impingement of the shoulder. And there are 4 structures in that space. We want a big space in there. So when I'm getting my arm up over my head and I'm doing that repeatedly, studies have shown that is going to elicit some sort of chronic shoulder problem because you're compressing those tissues over and over again. So to keep a lot of space between that, it's a bone on your scapula, between that and your humerus, to keep that space, the palm really should be up. So we want to minimize joint stress. Number 2 is it's really time dependent. I mean, it really is. And Alice here is stretching her pecs because her posture is not very good. So she noticed the position of this stretch. She's doing a doorway, especially for older adults. How many older adults do you know that have great posture? I mean, honestly. I mean, it's almost laughable. They don't have good posture. And people say, well, so what? Well, if you don't have good posture, what I want you to do, go ahead and slouch. So go ahead and slouch, just kind of slouch forward. And I want you to try to take a deep breath. Try to do that. Now, sit up tall. Now take a deep breath. Okay, the other thing is shoulder function. So if you're hunched down, now I want you to try to put your arm up over your head. Slouch. Now, sit up really tall, and now get your arm up over your head. So those are 2, there are many more examples, but those are 2 very tangible reasons why we need good posture. Plus, it makes you look, 10 to 15 years younger straight away when you have good posture. See how the elbow is slightly above the shoulder? By having the elbow slightly above the shoulder, as he's doing, now he's on the floor, he's got weights to hold him there, you're stretching the 3 sections of the pec. There's upper, middle, and lower. There are 3 divisions, and you're getting all 3. If you're down here, just making a T, you're missing the lower portion. So that gets all 3, especially if you have rotator cuff surgery or you had frozen shoulder, something like that. You really need to get all 3 divisions. This also stretches the capsule, by the way. Next. And he's doing a long stretch, by the way. And we talked about the purpose. Go ahead, next. The strengthening, especially for your seniors, I don't recommend doing that every day. Give them a day between, but the cardio should be every day. The stretching, every day. Balance training, every day. Every day. Strengthening, you just need more recovery. But here's a question for you. You're going to hate this one, by the way. And the reason I say that is because the answer kind of catches people off guard. To lengthen muscles. If you want to lengthen muscles that have adaptively shortened over time, hamstrings, pecs, from posture, what have you, how long should you hold a stretch? A, 15 to 30 seconds. B, 10 to 20 minutes. 6 to, a minute to 3 minutes. Or 5 minutes. It's a loaded question. If you want to if you're just looking to prevent a contraction, prevent injury. So let's say you're ready to go out and play basketball and you've got an Achilles issue. Hold your stretch for 15 to 30 seconds. You can even do a little bit of a ballistic stretch. But if you're looking to actually lengthen tissue, the collagen that forms the basis of tendons, ligaments, muscles, 10 to 20 minutes. That's not my opinion. That's what the data says. So if you have somebody with cerebral palsy, for example, or they've had a stroke, or they have frozen shoulder, that's where that data came from. We wanted to see, how long do you have to hold, and how do you load those muscles? How do you load them, and how long do you need to load them for in order to actually lengthen them so they don't just go back? And it was at least 10 to 15 minutes. And so that doesn't mean you should go and have all your residents do long stretches. That takes quite a bit of skill to set up. And remember, that is not a high-intensity stretch. When you were setting up that stretch, like, for example, the gentleman there doing his pec stretch for posture, his intensity when he set up was only a 2, like a 1 or a 2. He could barely even hold. You don't notice that it was stretching. But after 5 minutes, he was angry. So it's something that you're actually tearing the fibers. I know it sounds gross and sounds wrong, but that's what you need to do to actually lengthen it. You're taking the fibers, which are kind of disorganized like this, and you're making them go parallel again, okay? It's my new dance move. Okay, next. And it's based on Hooke's law. So those of you that have studied physics, you've got stress versus strain, whereas when you pull it, so if you have a rubber band and you just pull it, it just goes back, right? That stress is proportional to strain. But if I hold that rubber band and I keep holding it, I get to what's called the yield point. And that yield point we call the plastic region, which depending on the material, it can actually deform and it won't go back unless you actually hold it in that shortened position. Okay? So I know it's hard to grasp that you really want to hold it that long, but and then there's endurance training. And with endurance training, number one, it is time dependent. So the longer you go, the more beneficial it is. So as long as it's not to the point where you're, creating somebody that's going to create a situation where they're going to actually get injured from it, But this is a daily thing. So at least 15 to 20 to 30 minutes, depending on the person, work up from there. I would say with your residents coming from COVID, even just 2 minutes, 3 minutes, you got to start somewhere. But again, it all depends on RPE. I hope you're starting to appreciate how important RPE is. If you don't know that number, it's virtually impossible to prescribe any of this. But we got to minimize joint stress. And you can see her knees. You don't want that. That's called valgus. Watch your knees correct. That's what you want right there. And almost, if you have an elliptical or somebody's doing a squat, which obviously is not an endurance exercise, or a lunge, that valgus where the knees collapse inward is catastrophic for the knee. So one thing we didn't show when we talked about the squat is the importance of keeping the knees straight and not allowing them to come in. And I wanted to show you that. But again, endurance training carries with it immune system function improvement, as long as you don't overdo it, right? We talked about the range. It minimizes joint stress. It reduces body fat, which we talked about. When you increase body fat, you have a high level of body fat. That's an inflammatory state. We know that, which increases cytokine production, which increases coagulation risk, a coagulopathy, if you will. And that's associated with really, really bad prognosis with COVID. Okay. And then I think lastly, we have body composition. And this is fat to muscle. These are the 4 components of fitness, right? So it's fat to muscle ratio and it's body mass index. So it's dictated by your exercise habits, but a lot more with dietary habits. So hopefully you and all your residents are making wise food choices during this pandemic. It is more important now than ever because of our isolation. But I really appreciate all of you stopping by, and hope to see you again. Thank you.
Thank you so much, Colin. That was a great presentation. So we did have a few questions come through, so we're going to take just a couple of minutes here, Colin, if that's all right, and jump into these. So we had this question roll through, which you may or may not really be able to provide insight on, but how do you justify billing a Medicare for a stretch that you're performing for 10 to 20 minutes? It doesn't necessarily come across as a skilled service for therapy billing. Do you have advice on that?
Actually, it does. So a definition of a skilled intervention, skilled treatment, is where it has to address the patient's impairment. So if they have an impairment that's affecting their function, let's use the hamstrings, for example. Let's say that they do have tight hamstrings, that as long as you do these, as long as you follow this protocol, that it's related to impairments, and then let's say you set them up, that is skilled to set them up on a hamstring stretch. That does take a lot of attention to making sure that the pelvis is set, because when you do a hamstring stretch, it tends to put you into a posterior pelvic tilt. What's that person's back situation like? What's the contralateral? What's the other hip doing? Because if they have a tight rectus femoris on the other side, you can kill their backs. I mean, their backs can really be compromised. So you have to set the pelvis, which is draw maneuver, neutral pelvis, set that while getting them to a point which is therapeutic, but not potentially injurious, right? Not going to injure them. So you set them up to go to maybe a level, and what's the intensity of that stretch? It should be a 1 or a 2. Then, now if you leave the room, that's in violation. You can't do that. You have to be present. With Medicare rules, you have to be present. And also, if you're going to work with somebody else, then that becomes a question of billing too, because then it can be categorized as group. But that is the whole thing that I don't know how your clinic is run. It depends on how your clinic is run. But the way we did our billing is that we billed 97110, which is therapeutic exercise for that, which we didn't bill 97530 because 530 is more dynamic and more of a functional activity, and that's harder to defend using 97530. But 97110 is, I've been through Medicare with this, and I know that, and we've billed a lot for that. So it is a skilled intervention because you are addressing an impairment, and there hasn't been one study to refute it. Think about that. With almost all the interventions that we have, there's a small segment of studies that say no. But for prolonged stretching, it's there. The data is there. And if you need that, go ahead and email me. I'll send you the data so that you have that as a backup. But if anybody questions you, but it is therapeutic and it is appropriate to bill Medicare for that, as long as the other parameters are met.
Excellent. Thank you. That's very informative. And this next one that came through, for the reduction of fall risk, how do you deal with anxiety in a moderate strong balance exercise?
Yeah, such a great question. At the risk of promoting S3, as long as they have something stable there, right? Let them grab. Okay, so when they start, and let's say they've got a vestibular impairment, they're 200 years old, they've got this fall risk that's through the roof, let them grab. They're not going to wobble, which is fine. At least they're up. Then you progress. Okay, the next day or even the following week, you're going to let them release their grip just a little bit. You're not going to leave them. Okay, you're there with them. And remember, they're using a device, either parallel bars or S3 or something that grounds them to the floor. Because as I showed you, if you're doing it manually and you give way, you're going to put a permanent fear, and it's not going to, I don't see that coming back anytime soon. So my point is that you can graduate them from a full grip to an open grip. They're still touching, right, which is going to make them a little bit more unstable, to then a floating grip, which is where they're about an inch or so away from that surface. And then now they're wobbling, and guess what happens? They see now that they can maintain their balance in free space in a compromised position. If they don't get to that point, if they don't start that, then it's a disservice. You're exposing them to not being able to recover in a fall situation. They've got to be standing, they've got to be unstable. But the progression from closed to open to floating is different for each person. What I would say is, judging by their facial expressions and their fear, allow that to go to its own volition. There's no rule that says they got to get to a floating grip in a week or 2 weeks. Who cares? As long as they're not sitting and they've started that process. It is magical to watch. I will not kid you. To watch somebody, whether using parallel bars, S3, or whatever it is that they're using, but the body responds. It's really amazing to watch that response in real time.
And now, for anybody interested in learning about how Direct Supply can help you navigate these new technologies and products, please help me welcome our dedicated senior product consultant, Kelly Sullivan.
Hello, I'm Kelly Sullivan. I'm a senior product consultant here at Direct Supply. Today, I want to discuss with you the S3 Balance, which is a really unique exercise and transfer frame that uses applied research and exercise science to reduce the risk of falls. There are 5 different functions of the frame itself and what it can do. One, it can help with balance training. It can also help with strength training, flexibility training, transfers, as well as fall recovery. So there's lots of different functions that are available with this particular product. It has a non-porous frame, so it's easy to wipe down and disinfect. That said, you can use it in various different settings. So perhaps you want to use it in a resident room for individual use, or maybe you want to set up a group class in a gym setting. You can do that as a group setting as well. The classes can be conducted in various different ways. You can have a staff member lead the group. You can have the group follow a video, or a resident can lead the actual exercise class as well, which actually is the most successful model. And S3 Balance, the team suggests that after 2 to 3 weeks or so, you should introduce that into your classroom programming, because it's really highly recommended and successful. When we look at the frame itself, it offers a lot of different exercises. And I'm going to get into that in just a second. Before we move into that, I want to talk about the support that the team offers you. So the S3 Balance team has established a couple different portals on their website. One being the basic portal, which is free to any customer. And that includes a instruction manual, access to instruction manual, 2 classes that you can gain access to. You also have access to an overview training of the frame itself and what it can do, as well as some cue cards or exercise cards. And the exercise cards are really cool because they give you a good framework as to what each and every exercise is that is built into those different classes. So those can be either laminated, posted up in your gym, or perhaps handed out to the residents in their rooms so they can follow along with those cue cards as well. The premium portal, you would have to pay a nominal annual fee for, but it does offer a lot more in terms of resources. You have access to a certification program. You have direct access to Colin and team to help with guidance in your programming. You have a whole abundance of different classes that you can have tap into and utilize in your community. And a lot of them have really specific focus areas like proprioception or vestibular balance training. So there's a lot of different options for you to choose from. You also will get check-ins every 2 weeks through your email platform as well. So there's a lot of support there to be had, whether that be you're utilizing the basic or the premium portal. I want to talk a little bit about transfers. Now, I mentioned that being one of the functions, and you might wonder, how would I transfer someone with this particular product? Well, this is a portable system, as I mentioned, so there are casters along the bottom here of the base of the frame. It can be used, transported either in a wheelbarrow kind of option here where I can move it this way in short distances, or I can come around the front and I can pull from the front if I'm going longer distances. I can wheel this in and out of rooms quite easily. But more importantly, when I'm trying to, perform a transfer with an individual, I would align the side of the frame on the bed so that they could use the side of the frame here to help hoist themselves up in bed, swing their legs over, and prepare for a sit to stand out of bed. Now, if I want additional assistance from that sit to stand in that transfer, I can then position the frame so it's facing the side of the bed here. Let's see if this was the bed. The legs can go underneath the bed. The resident would be sitting at the edge of the bed. They can grab hold and then use this as a stability frame to get up to an upright position. It does have enough room inside here of the frame to accommodate a walker. So then what I would do is I would then wheel this away once they're done with that sit to stand activity. So couple different options in terms of transfers and how you use the frame outside of all the various different training options it provides as well. I want to talk a little bit about some of the safety and challenge options too that you have. So before I get into all the exercises and some of my favorites, I want to show you a couple options. So before I begin an exercise, I want to look at, what is the ability of the resident? Where are they at? A couple of the different options you might suggest to that individual is maybe start them off with a closed grip around the frame to begin the exercise. Then we might progress to an open grip and eventually move to a hand float above the frame itself. So it's going to progressively get more challenging for the individual as they engage in that activity. I might also want to be looking at how to test for proprioception or where their wobble's at with different particular activities. And so I might have them close their eyes or maybe tilt their head back and look up at the ceiling as they're engaging in that activity. So one great example of how I might test this, and as we're talking through proprioception in particular, I would do a heel to toe balance training activity where their heel is straight up against the back of that The heel is touching the toe, and then I would have them go through that close to open to float to potentially closed eye, and then maybe head up, look up. And I want to then calculate where their wobble's at or where they're having difficulty. And the nice thing is that they always have the frame here for balance and stability if they need to grab back onto it. So moving on from there, I want to showcase a couple different options that you can consider when you're looking at the product. I mentioned the cue cards, where they have all these different exercises to follow that are incorporated into their various classrooms or their virtual classrooms if you choose to go that route. And so one that I really like is, I just showed the heel to toe, but I also really like a good lower back stretch where we grab onto the frame and we push back and we hold on and we look down about 2 feet in front of us, and we have that nice elongated back, and we stretch not only the lower back, but my hamstrings are getting stretched out there. It's a great stretch. Another one is to kick the heel up or the foot up over the mid bar here, and then kind of sit back into it. So there I'm getting a nice stretch through my calf, through my hamstring. Great stretch. If I want to stretch an upper body stretch, I like the high five where I'm crossing the body with my hand and I'm high-fiving my neighbor maybe. And that gives me a nice overall stretch, midway stretch across my body, stretches out my shoulder, and really gets me loosened up for the rest of the exercise that we're gonna do. Some other additional options to consider that really target some big muscle groups. As we know, those quads are extremely important for stability and balance. So if we go into a nice squat here, I can grab on. Again, I have those options. In terms of how I want to position myself on the frame, but you have that stable frame to kind of balance you in that nice traditional squat. You can do side exercises where I can do a step forward, squat together, and so you can use that frame again almost as like a ballet bar in front of you as you move through that exercise. So those are just a couple suggestions. I mean, again, they have a whole host of options for you to choose from. I would recommend, or I guess Direct Supply and S3 Balance would recommend you also consider purchasing their strength kit. Their strength kit comes with resistance bands that can be connected to various different points throughout the frame. So here you can see there's a little loop here. Those are positioned throughout the frame so that you can do some strength training exercises as well. So if, for instance, if I wanted to do a chest press, I might attach 2 resistance bands here underneath the frame and I'd pull back, right? If I wanted to do a tricep, I can pull across my body, maybe a rotator cuff where I open up that chest. If I want to attach to the lower frame, now I can really focus on the lower extremities, maybe working adduction muscles, and targeting some of those big muscle groups again that we know are extremely important for balance. So I just wanted to say this is before we leave today, I'd be remiss if I didn't mention that it's a really easy product to stow away as well. Think about when you go to the grocery store and you see that big line of shopping carts lined up. This frame is designed to do the same. So if you have multiple frames, they kind of click into each other so that you save on space. So you don't have all these frames floating around your gym. You can click them all into a nice row in the corner of the room so they're stowed away nice and neatly. And so that's something to keep in mind if you're looking at a group setting environment when you're considering the S3 Balance. If you have any additional questions, please feel free to reach out to your account manager. There is also a trial option available, and we'd be happy to discuss that with you. Any other questions you have, they can always defer to me, or I can loop in Colin and team to help answer those questions for you. Thank you so much for your time today.
Thank you so much for joining us. Thank you for such great questions, and an extra big thank you to both Colin and Kelly for their expertise and their time today. Please note that you can always email us at webinars@directsupply.com with any additional follow-up. Thank you so much for coming today.